So health and social care is a massive industry, and it's complex, and it seems to be changing on a monthly, if not weekly basis. I think Croydon spends about £650 million on various services, and that gives an organisation like Healthwatch many different areas that we can choose to focus on. So we have to be quite specific in what we're doing, and quite focused. And you've heard a few times today, and I'm going to reiterate, one of our main focuses has been how we increase the capacity, the range and the quality of views and comments that we get into the office so that we can turn that into meaningful intelligence. This year we recruited actually a community engagement manager and a volunteer coordinator, an outreach coordinator, who doubles as a volunteer coordinator, to increase our capacity of getting views in the office. And Robin has been doing a lot of very structured work around improving our profile with organisations, so going and doing presentations, but also doing structured outreach in the community, in various locations in the community, focused around CUH, Croydon University Hospital, so that we can increase the volume and the variety and the types of views that we've been getting in. In terms of reaching hard-to-reach communities, I think we recognise that we're not always going to have immediate access to every demographic and every characteristic of the people that we're looking to talk to. And so we've invested quite a bit of time and effort in developing partnerships and links with other organisations that do have that access, so that we can work through them. And partnerships certainly is very much a characteristic of the way we've been working and how we'll be working going forward in partnership with other organisations. And I'd just like to acknowledge at this point the help and the work of the Asian Resource Centre, of the BME Forum, of CAISH and of ASCII. You've all been very helpful to us this year in helping to reach BME communities. So thank you very much to all of those. You've heard from Gordon already how last year we accessed £10,000 of funding from South West London CCG to provide grassroots events. And the model that we use here is we distribute those monies to grassroots communities. They put on events, and then we can go and talk to them about certain health and social care issues that we're interested in finding out about. So that's been another really, really effective way that we've continued this year in finding and accessing grassroots communities and hard-to-reach communities. And it's also provided another £10,000 of social value into the borough. So it's been a dual benefit. Again, my opportunity now to thank our volunteers. They've been instrumental in all that we've done, not just in outreach. And they actually do come out with us very often on a weekly basis to gather views and do the engagement. And we're really, really grateful for the effort they put in to do that. But actually, in coming every week into our offices to help us code and analyse this data, so that we get something like independent verification. And that gives us a quality assurance process so that we actually understand that the data that we get in is robust, and that the views that we say are coming from people are actually have been through a methodology that makes us very comfortable with recommending what we recommend as a result of the views coming in. But there's a lot more that we could do, and our mandate, as well as gathering views of people, is about understanding their experiences of particular services. And Croydon, as you'll see from here, has quite a large range of services, health-related services. There's 57 GP practices, there's 75 dentists, there's 3 GP hubs, there's 3 primary care hubs, there's 3 acute hospitals. But in addition to that, if we add social care, there's about 77 different care homes in Croydon and about 37 different pharmacies. And what we want to do is to be able to get patients and public's views of their experience of those services as soon as possible, as quickly as at the point of access as possible, because that will help us to make much more rigorous recommendations when we talk to commissioners and service providers based on real life experience. We're looking to gather as many views of people's experience of these services. And one of the ways that we've chosen to do it is actually digitally, because it gives us the opportunity to increase the volume of views that we get and to do it much more quickly. So Yinka, could you maybe just on our website? That's it. You just want to move down, scroll down slightly. We very recently launched this functionality, which is called a feedback centre, which is now part of our website. On it, you'll find views of people who've already reviewed some of the services. Now this contains, or will contain, all the CQC registered services in the borough. It immediately gives us an information source, so anybody who's logging on here can find basic details of the services. But what it also does, and what it also will do, is give people the opportunity to see what other people think of these services. So you'll be able to see whether they've had good experiences, bad experiences. They'll be able to decide, for example, which GP service they wish to use based on the experience that we've provided here. Going forward, it's going to provide a really effective information and signposting service. You can see we've already started to collect some of the views.